All right, well, folks, let's start the show. Man, I'm a rookie, folks. I haven't. Jeez. All right, here we go again, folks. Sorry about that. Here we go. Well, hello everyone. Today is a great day. I think it's a rainy day. I'm not sure if it's rainy where you're at, but today we have a great community resource here on the Accessibility Corner. And just before I go any further, this resource is on our website, which is www.theaccessibilitycorner.com. And today we're going to be talking to Mr. Carlos Salais from the Centro San Vicente Health Clinic or Center. And we're going to be talking about an event they're going to have in September, which is pretty neat. It was on our flyer. The flyer was on our post. And first of all, before we go any further, Mr. Salais, thank you for doing this so much, sir. And first of all, how are you doing today?
I'm good. Thank you, George, for having us on your podcast for today on the Accessibility Corner. Like you say, we are a resource that's on the community for our community.
Amen to that, yes, sir. And just a programming note, we are working on having La Familia del Norte, they're a clinic that deals with mental health issues. And then we're also, Miss Bonnie Perez, she was going to be on our show this time, but she got sick from, you know what, but she's doing great. That's great. So she's the director for the PIN project, and she's going to be scheduled in 2 weeks. So anyways, before we go any further, Mr. Salais, can you just tell people just a quick background on yourself?
So, I'm born and raised here in El Paso, Texas. Part of my childhood, grew up in Juarez across the border. Um, I've been working for the community over the last couple of years. I'm a big LGBTQI activist. I was part of El Paso Sun City Pride for 12 years. I also sat on the board of directors for Border AIDS Partnership here in El Paso, Texas, which is a nonprofit organization that has raised thousands of dollars for different agencies, not only in El Paso, but also Las Cruces and Ciudad Juarez. And now my current role is that I'm the dental office manager for Centro San Vicente, which is a nonprofit organization here in El Paso, which is also a federal qualified health center, meaning that we get a lot of our funds from federal and state government.
And I've seen you on Facebook for a while, Mr. Salais, and he is right, folks. He does a lot of stuff in the community. That's why when he says yes, he'll do a show. I'm like, oh, really? Cool. I did one of those party dance. Yeah, all right. Because, you get some people that are recognized to be on the show, and that's what we want to do here. We want to be community resources for those with and without disabilities, because a lot of our segments in the population, as you know, Mr. Salais, are underserved, the homeless shelters, or the homeless community, especially people with disabilities. I mean, you just name it. You go check.
Right.
So we're going to do, and ask Mr. Salais if I could do this. We're going to play a video. It kind of gives the mission of what the San Vicente is doing. So I'm going to go ahead and play that video. Okay, Mr. Salais?
Go right ahead.
Okay.
My name is Jose Luna Jr. I am a physician. I've been practicing medicine for over 30 years. I am currently the CEO of Centro San Vicente.
It's a one-stop shop. So we have anything here from your primary care doctor to a laboratory to a dental facility, a pharmacy. We have satellite clinics to offer those services to patients throughout our city.
We serve the homeless population in the community, free services, laboratory, medication.
We're here to serve any individual who walks through our door, whether or not they're insured, uninsured. Legal status is not an issue for us. Gender is not an issue for us. Religion is not an issue for us.
Our primary concern is to help those without insurance. Our mission is to advocate for social justice. Almost 70% of the patients that we serve are too poor to qualify for any type of healthcare exchange. Just the fact that you do not have health insurance increases your risk of dying prematurely by 25%.
Some of the specialties that we have here in the clinic that aid for our patients' care is dental.
I believe our team provides, compassionate care to individuals who may not otherwise get these services.
We also want to be a center of excellence to help provide quality health care for our LGBTQ community.
There are several areas in town that are so underserved, and the patients, because of their language, the cultural barriers, go without care, and so many of them still go to Juarez. I want us to be in a position that we do not have to go across the border, that we can provide health care to everybody right here in our city. It's important to fight for your rights, because I believe that health care is a human right and not a privilege. We are the only industrialized country in the whole world that does not provide health care to all of its citizens. We must have some form of universal care in this country to provide health care to all of us on an equal basis. I have access to go to any automobile dealer and buy the most expensive car, but I have access to it, but do I actually have the funds to purchase it? So there is a difference between having access and actually being able to pay for your health care. I serve, and by serving, as long as we have air to breathe, we will continue to provide care to these patients.
And we're back. So yes, that, as you know, this clinic, Mr. Salais, is very important, because I found out through this clinic through my tia. And I just think that people really need to know what's out there in case they don't have insurance, or they're scared of their legal status, because I see that a lot. I mean, it's very unfortunate, and they have to go without health care. But anywho, let's go ahead and talk about your event on the 24th. So this is the first annual. This is the first time you're going to do this event?
Yes, this is the first time that Centro San Vicente is doing this type of a fundraiser. As you all know, and I mentioned before, we are a nonprofit organization. A lot of our funding does come from the federal and state governments, and also from local government as well. But the majority of our funds do come by private donations and people by our community. Our goal this year, because it's our first year, we want to expose ourselves to the community, that we're here for them. So it's more of what's the word I'm looking for? I'm sorry.
That's okay.
It's just to showcase our facility. We are doing, it's called Building the Community, because we want to bring the community together. It's going to be a cyclist and fun walk. It's not a competitive walk or cycling. It's just for the community to come together, do some physical activities. It's going to be at Escalante Park on September 24 from 8 in the morning to 12. We're also going to have a small little mini health fair from different agencies in the city, along with our different departments that we have at Centro San Vicente.
Now, let me ask you one question. I saw the fee. Is it $25? I forgot. I saw real quick, but you didn't.
Yes, it is. I'm sorry if I'm looking down. I have my notes here.
No, that's okay.
It is $25 per person. For teams of 4, it's going to be $60. And if you have more than 4 members on your team, after the $60, each additional member will pay only $5 to participate.
Is it? And then how long is the walk? Is it just más o menos?
It's just around the lake. For the walk, it's going to be along the lake near the. It goes around the main part of the road, and then it goes towards like where the golf course is, and then by the fire department where they do their trainings, and then it ends by the pool area. And
That's
then
a
the
long walk.
cycling, it seems long, but it's not. And then it's
No, I'm
just
saying it's a
at
good
the
walk.
end of the
Well,
walk.
with somebody in my shape, so I have a hard time walking to the kitchen. But anyways, go ahead, sir.
It's an easy walk. And then for the cycling, it's going to be around the road. And I
Okay.
believe it's going to go ahead around where like Western Playland used to be, and then back to where the pool area is. So it's a very simple, very easy. It's a family event. You could take your pets as well. We are encouraging people to dress up if you're going in teams. Just like show some pride, show spirit. I mean, come on, this is about you guys. It's about the community, and
Exactly.
of course, we're trying to raise $25,000 is our goal for this year, being our first year. I know with the community out there, we're gonna be able to exceed those 25,000s and maybe go into 40,000s. But our goal for this year is $25,000, and we're also gonna be selling some paletas in El Paso, even though it's kind of the fall weather already, El Paso's weather is always hot. So we have
Mm.
paletas and we're planning on selling some hot dogs as well.
Oh, I'm just going for the hot dogs. I'm telling you straight out right now, okay? Not
That's
really.
perfectly fine.
But I'm gonna tell you what's Mr. Salais, what do you see is the biggest I want to say challenge, but barrier regarding the outreach when it comes to outreach for organizations like yourself? What do you see? Is it just the lack of media exposure, or is it just because the word of mouth is great, right? The word of mouth is great, but by the time it goes around the circle, that's the thing. But I think events like this help, right, in outreach.
It does. Doing being out there and exposing ourselves to the community, it's a great way for us to make a presence in our community. And you're absolutely correct. A lot of people don't know that we even exist. Even though Centro San Vicente has been around since 1984, so it's
Oh wow.
been around almost for 40 years, and people still don't know about us, or they're afraid because of their legal status. Um, I'm very honored to be working for this agency, giving back to the community. We don't judge; it's a judge-free zone. Um, so doing this event is going to help us to put ourselves out there. Um, Being able to communicate with the media as well is going to help us a whole lot for us to be out there and people to know that we exist so they can come
Exactly.
in and get some help. Um, like Dr. Luna said on the video, um, unfortunately, we live in a city where a lot of people are uninsured, and some
Mm.
people cannot even afford insurance, even if they wanted to through their workplace. I know I couldn't afford it because it was too expensive. Sometimes you're either you pay for your insurance or you pay rent.
Yep.
That's how bad things are. So knowing that you could go to Centro San Vicente, apply for a discount, be able to be seen, even if you don't have money, there's always a way for you to be seen.
What's the process? So when someone goes in, it's just a process of registering. I can't say that word. Getting on the system, and then once you get in the system, is that what- to kind of evaluate your situation, like income wise, if you're working and whatnot?
Correct. So basically, you just go with your ID, um, and then you go from there. You get registered. If you have insurance, that's amazing. That's awesome. We will still see you. But I always recommend people to apply for the discount. Even if you register with some Vicente, doesn't mean that you're gonna get the discount right away because some people do have insurances and they would just rather use the insurance but still register. Go through the process of trying to see if you qualify for the discount. Um, and I'm talking about my department in dental. A lot of people have dental insurance, but let's be realistic, dental is very expensive. $2,100, $2,500 a year is not may not cover the whole treatment. So
Hmm.
take advantage and try to see if you get for the discount. That way, whatever your insurance doesn't cover, you pay at a discounted price.
I think that's why those, if as being from this area, people who are listening that are from this area, a lot of people go into Juarez for the dental because it's cheaper over there. That's the reason why it's so expensive. I mean, so
It
expensive.
is.
It's ridiculous. I'm like, I think my tia has some job for, I think it was a root canal, like $4,000. I'm like, dang, that's a lot of money for a root canal. But I guess you have to do it, right? I mean, what can you do for you? Now, for
I
you at your facility, do you have, this is a question somebody asked me this morning through Messenger. Does, do they have physicians or is it like you? Do you have a dentist there or how does, or are they students or?
No, no. Centro Health Center, we have doctors, we have nurse practitioners, we have nurses. Um, in the dental, we do have, currently we have two dentists, and we have dental assistants and two hygienists. So
Okay.
we are covered. We do have professionals. Um, the great part is we are partnering with Texas Tech um, by the end of next year to start getting some of their students who are going to be starting doing the clinicals in the dental school go to our facility to do their
Oh wow.
services.
Cool. All right. That's
So
great. Yeah, yeah, yeah.
we're getting the community together.
Yep, there you go. There's buildings. Yeah, yeah. So, and I was looking at the website earlier. I didn't realize that. I thought it was only one facility, but there's actually there's three of them.
We have so our main clinic is on Alameda, which is 8061 Alameda Avenue, uh, maybe like a block away from Yarborough and Alameda. And
Okay.
then we have our second location, which is at San Elizario, um, which is 13017 Perico Road, San Elizario, Texas, 79849. That's general practice. We don't, the only place that we have dental is at the Alameda location. Okay.
Okay.
And then we have the Pebble Hills Clinic, which is one of the newest additions that they had. And to be honest with you, I believe that started as a prep clinic, which is medication for to avoid to contacting HIV. But it's also a family practice building now as well. And they do most of their LGBTQI services from Pebble Hills. And the address for Pebble Hills is 10780 Pebble Hills, Suite G1. And then we have the third area, which is not a clinic, but we do provide services for the homeless at the Opportunity Center on Myrtle.
You know what? One thing I want to tell you about the homeless community there, Mr. Sally. You know this. I'm just telling those who don't know. I one time met a man when I was single before I got married, and so one day I was outside waiting for my bus to pick me up to go to work, and I'm standing there, and some guy just comes walking to me, real nice man, and we're just talking, and all of a sudden when he left, I heard someone walking real fast towards me, and I can't see, so I'm like, oh, what's going on? And it was a soldier. He told me, I'm whatever. He goes, hey, was that man bothering you? I'm like, no, why? He goes, oh, he was a homeless guy. But what I'm trying to say is, we take things for granted, like food and like healthcare, and the reason I'm saying is because just to bring more context to the homeless population, he waited, Mr. Sally, to that to the OAC, the OC, I'm sorry, Occupational Center. He waited for he was telling me 4 or 5 months for his glasses and glucose to take his blood, for diabetes. He got it. It's the same night they beat him up, broke his ribs. He was in UMC, and they stole his stuff. And I'm like, wow, all that time, Portocito, he waited. So this kind of stuff is very crucial. Funding, folks, help them out. Because, this kind of funding really helps people that, because we think, like you said, we take things for granted. We have this, we have that, but those who don't, this is a great opportunity to come back and contribute back to something like San Vicente. And 25,000 folks, come on. We could do it. $25, $60. Even if we just go for a stroll, pay $25. And that probably you mentioned the prices. So this ain't me and my wife go. That's $50.
Correct.
So which is not bad. I mean, it's a good walk. And you're giving into a good organization that really provides services to the community. And so one more thing before I let you go, Mr. Salais, and I've always been interested to ask someone in the healthcare industry, kind of a little bit off topic, but and I guess people are going to ask the same question when they go to a clinic, any clinic. What's the protocol when it comes to COVID?
So we do have screeners at the front of the clinic. They will take your temperature. We do require masks. I know it's not mandated, but for us in our clinic, we do require everybody that walks into our property to wear masks. Our doctors, our providers, they actually wear two masks. They wear the N95 masks, plus they wear the surgical mask whenever they're with patients. We're trying to take all the precautions in the world just to make sure that we keep our community safe as well as ourselves and our families.
Of course.
We kind of stayed open during the whole main part of the pandemic, we were doing triage for COVID patients. We still do triage for COVID patients. For my department for dental, if you feel sick and you have a dental appointment, we do ask for you to call us to reschedule your appointment just to make sure that you feel better and to keep our department also in good standards for us to be able to provide services for other patients as well. So it's a mutual thing that we ask from patients as well as from our providers.
And one thing, I'm looking at my notes right now, and I forgot to ask you this question. So let's say someone goes in and to get services. Let's say dental services, okay? Infected tooth, for example, and they qualify for the discount. Do they have to pay the remaining balance right away, or is it in payments?
No, one thing that I do want to go ahead and make clear and clarify, if you don't have the money to make the payment, don't worry about it. We can make payment arrangements. For me and for the rest of the agency, the well-being of our community is the most important part. If you have a dollar to make payments towards your services, that's fine. Go ahead and give the dollar. But if you don't have the money, it's not a reason for you not to go and get treated.
Even more reason folks to come out and support San Vicente, because now I did it on purpose. I know if you got that. I did it on purpose to show people that how much your agency gives back to the community, and as those things are so crucial, folks. Dental, just even if you're diabetic, you probably know this, Mr. Salais. If you're diabetic, your
Yes.
teeth are very important because to keep your nutrients and all that. So, I mean, just overall, and you have labs there too, right, sir?
So we have labs, we have a pharmacy at the Alameda location, we have x-rays, we have behavioral health, mental health, we have diabetes classes as well. There are several classes that are there's a department that does educational stuff for the community, that do those kind of teachings or learnings for the community. I know here in the border, being Hispanics, diabetes is one of the main chronic diseases that we have. So we do educate our community as well. One thing that I ask, I'm diabetic myself. Make sure that to stay on your treatment. If you don't have a doctor, remember we are out there. Go register, get into the discount. So you could get seen and your medication will be there as well. It's a one-stop shop, like Dr. Christina Paz stated on the video. We are a one-stop shop, and it's very hard to find something like that in El Paso
Yes.
or anywhere. So why not take advantage of the resources that you do have in the community and that we're providing?
Earlier today I saw on Facebook, Mr. Salais, I saw someone I know post I guess it was a picture. I'm assuming because I can't see it, but it was her prescription, and she posted it. I guess she took a picture of the thing. It was I don't know what type of medication it was. $1,622. I'm like, dang, that's a lot. I remember when I was gonna get my eye drops. I went to the doctor like 3 months ago, and the eye drops were like 500 and something. My wife, she's like, no, I'm like, I'm not lying. She goes, you don't want to get them. I'm like, it's not. And I had to call the pharmacy, and $500 for eye drops a month.
You know
A month.
what, George? I'm sorry to interrupt. Even with insurances, because I know when I got diagnosed with diabetes, I had my insurance have you normally been really good with medication coverage. I was surprised though how much two of my medications for diabetes were coming out to because part of the insurance didn't want to cover most of it. So one of them was almost like $700 for
Wow.
like a 30-day supply. The other one was another $400 for 12 injections. So the importance of us being able to provide those services to our community and those discounts at a discounted rate, or maybe even at no charge for medication, is really important. So that's why we do ask the community to give up a Starbucks for one day and give those $6-7 into our organization or to any agency that's willing to go ahead and help the community.
So crucial, like you said, the private donations. That's one of the drivers to for the success. And what's the hours
Correct.
there? Mr. Sai?
Currently, we're doing 8 in the morning to 5 p.m. Um, Normally, the clinic would pre COVID, they were working from 7 in the morning to 7 p.m. Um, I'm not sure if there's any plans of changing the schedule again to how it was pre-COVID. So just going to our website to salvicente.org for any updates if we start seeing patients later on as well, because we do know the importance. A lot of people also don't want to
Miss work.
leave work because, of course, that's the day that sometimes a lot of companies don't pay for you to be out. So just keep your eyes open, go into our website or give us a call at the clinic for you guys to know if there's any changes on our schedules. But for now, it's Monday through Friday, 8 to 5.
What's the main number there, Mr. Sai?
The main number is 915-859-7545.
There you go, folks. I mean, this is a really opportunity for us to get back. And like you said, the $50 is for a couple is to go out and eat. For like me and my wife going out and dinner. Come on, guys. Give to an organization that really needs, that can really provide good services for those who really need it. Anything before, Mr. Salas, you want to tell the community?
I just remember there's always help out there. There's always resources out there for the community. Sometimes we have to do a little bit of homework to find them. But George, with the Accessibility Corner, has done a great job. I've gone through the website. He lists a lot of our community resources that were out there with phone numbers. Don't be afraid to go ahead and reach out to him, reach out to me. Anybody can go into Facebook and look me up. I'm very vocal. I'm an activist in the community. Even if it's not anything with the agency that I'm at, there's always a way that I can find out information for you.
True.
Being an activist that I am, so there's always somebody out there to help.
Can someone look for you on Facebook?
Yes, I'm under Carlos Salais. You can look for me. I'm always doing live videos. I'm also part of the council at my church, so I'm always helping out the church as well. So I'm always out there in the community, one way or another.
You are. You are. Eso sí,
Soy
you
el
are.
anjonjolí de todos los moles.
Yes, sir. God bless you for that. And you know,
Thank
and
you.
you're so right about the resources. I'll tell you a quick story how I started, why I started Accessibility Corner. And there's over 65 resources on there, and they're up to date. It's not like old ones. But a long time ago, there was a friend of mine that had a friend that his mom was blind, and of course they called me because they think all the blind people know each other, but we don't. But anyways, and so he called me. Hey, my mom's here, and she doesn't want to leave. She's elderly. She didn't want to stay. We don't want her to be by herself. So I'm like, So I started calling around, and I found a program. I don't know if it's still around after COVID, but it's called the Senior Companion Program. And what it does, a volunteer goes 20 hours a week to their home and just talks with them like a companion. You may make them a small sandwich and whatnot. And I'm like, so ever since then, I'm like, just like you said, ask. You never know. You might get a response like, wow, okay, there's something out there for me. So, but I thank you, Ms. Salais, for coming out on board, coming out here. No, not yet. So, but anyways, well, I'm gonna ask you one more thing. When it comes to, is there like when you sign up, do you have to go in or can you call in, or you have to go in to sign up?
For signing up, George, I don't know if you can put the flyer that I sent to you on Messenger.
Okay.
It has a QR code.
Okay.
For people to go ahead and scan it with their phones, and it will take them directly to the link for you to sign in.
Really? All right.
Yes.
Cool. So what I'm gonna do is put the flyer back on this post on this show on the comments, so people can see it. And that's a nice thing. It's technology, right? That's a good thing. Well, Mr. Salais, I thank you not only for what you do, for what you're doing for our community, but the person that you are. And just check them out, folks, on Facebook. And also remember, the September 24th. What time to what time again, sir?
It's 8 in the morning to 12. There will be several other organizations there at the event. doing a mini health fair as well. So come get to know us. Some of our departments at Centro San Vicente will have tables as well. As like my dental department will be there. Come and say hi
Yeah. And buy a hot dog.
and buy a hot dog, okay? Or
That's my thing.
paletas.
Right, there you go. Thank you, sir. Bless you. And be careful. Like I said, we're working on having La Familia del Norte and also the PEN project coming soon. So everyone could have a good night. Be safe. Mr. Salais, thank you. Be safe, everyone.
Thank you, George.
Bye-bye.
Bye-bye.
Bye-bye.